Hi again. In this tutorial we'll be looking at the structure of the pelvis, and then we will look at the vertebra one more time. So we will begin with the pelvis and the bones of the pelvis. The bones of the pelvis include the sacrum in the middle and the os coxa on the two sides. Os coxa, spelled O-S-C-O-X-A, os coxa, is made up of a fusion of three bones. So as you can see here, this is one os coxa, and the three bones are the ilium, the pubis, and the ischium. So three bones fuse together to form a single bone, and that bone, then two of those, one on this side, join the sacrum in the middle. The sacrum then articulates with the vertebral column. Shown here is the lower portion of the vertebral column. This is the L5, or the fifth lumbar vertebra. Remember the numbering system of the vertebra. The L5 will join the sacrum, the base of the sacrum. Okay, so the sacrum is like an inverted triangle, where the base is here and the apex is here. So the base of the sacrum will join the fifth lumbar vertebra. And here you can see the intervertebral discs. The joint of the sacrum with this bone is called, because the joint is at the level of the ilium, it's called the sacroiliac joint, or you can say iliosacral joint. Okay, this is a sacroiliac joint or iliosacral joint. There are openings in the sacrum. These are called sacral foramina. Foramen is singular, foramina is plural. So because there's more than one, it's plural foramina. So there are four of those. These are, because we're looking at it from the front, anterior view, we call it anterior sacral foramina. Furthermore, the bottom portion of the sacrum is attached to the coccyx. A coccyx is a small bone, and the joint is called the sacrococcygeal joint, which is this area here. The two os coxa are joined to each other. So you see there would be one here joined to the sacrum, both of which are joined to the sacrum by sacroiliac joint, but then they're joined to each other by the pubic symphysis. So I will show you a simple diagram now. As you can see in this drawing, here is the full view of the bone of the pelvis. So here we have the sacrum, here we have the sacroiliac joints, and this is the os coxa, pubis, ischium, ilium, all of this, ilium. The joint between the two os coxa is here. There is a cartilage here. This is a fibrocartilage. It is called the pubic symphysis. Holds the two together. Pubic symphysis. You can also, right now we can start going a little bit into detail. There's an angle here under the pubic symphysis called subpubic angle, because it's under the pubic symphysis. Subpubic angle. In males, this subpubic angle is narrower than in females. And this would be, for example, a male, and in female this would be much wider angle. The opening here is called the superior pelvic aperture. It separates the greater pelvis above from the lesser pelvis below. Furthermore, here you can see the sacrum. There is like little wings here where the joint is at the sacroiliac joint, but this portion here that ends up forming the joint, this portion of the sacrum, is called the ala of sacrum, A-L-A of sacrum.